I made a video back in May when I was originally going to be having an open myomectomy procedure to remove a large fibroid. The surgery got rescheduled for July 25th and then rescheduled for July 26th. So it's been exactly 2 weeks since this surgery, and I just wanted to give an update, talk a little bit about this surgery procedure and my recovery. And then I'm going to show the scar and my abdomen area so you can see what it looks like after 2 weeks post-op. I got to the hospital early. I think I was the first surgery of the day, and I was really nervous, but I'd been meditating and also like trying to relax and accept and surrender to the procedure. And I did have some fears in the back of my mind. I was worried about blood loss. I had a 15 centimeter fibroid that was on the posterior side of my uterus. So I just didn't quite understand how the surgeon was going to remove it since it's on the back side, but she was very confident. I went to Dr. Allison Jacoby at UCSF, University of California, San Francisco, and she was very confident the whole time. She told me that that's all she did was remove fibroids. So she didn't seem to think it would be an issue, and she said the surgery would take about 2.5 hours. I started crying a little bit before they were going to wheel me into the operating room. It became very real. And they gave me an injection of something that they said was like Valium, but it was faster acting. And then I calmed down. I just remember accepting it. They wheeled me into the surgery room and they told me to get on the operating table, which was, when I had imagined it before, was something that was very frightening to me, but I didn't feel scared at the time. I saw the doctor and her other doctor assistants looking at my MRI and deciding the best way to cut into the uterus. And then I laid down on the table, and the anesthesiologist told me to breathe deeply the fresh oxygen in the mask. And so I remember doing that, and I got to about 3 breaths, and they told me I'm doing so great. And then the next thing I knew, they were standing over me in recovery, telling me it was all over. So that was a really weird experience, to just go to sleep and the next minute wake up and have it be over, and 2 hours had passed. So it was 2 hours instead of 2.5. So it went really smooth. She said I didn't lose any blood. They were able to get the whole fibroid out, and they also gave me 2 injections in the side of my abdomen. So it was a pain blocker. So as soon as that kicked in, I really didn't feel anything. I just felt relieved, happy, and I was, right away my abdomen was flat. So that made me feel good that I didn't have that pregnancy fibroid belly anymore. And before the pain blocker kicked in, I did feel some pain. And so in recovery, they gave me an injection of fentanyl, which I guess is a really strong, I think it might be an opiate. And so I was really enjoying the first day. I thought surgery was a breeze. I felt great all through the whole day until the night started to wear off a little bit. So the pain is definitely bearable. It's less pain than what I experienced right before my periods when I had the fibroid, which was relentless, 48 hours of extreme pain. The surgery is not like that. I felt like when I would lay flat, I could barely feel pain. The first week was intense, though. I had my mom come stay with me, which was amazing, because all I would do is sleep, and then she would make me home-cooked meals, which I had an appetite from basically from when I woke up from surgery. I was hungry. And so she would make me meals, and I would wake up and eat, and then I'd be exhausted and go back to sleep. And so probably about day 3 or 4, I would start walking a little bit. I walked down to the end of my driveway, which is a long driveway. And actually, like day 4, I think it was, I only walked halfway down the driveway and I got too tired. So that's unusual for me because I'm used to having a lot of energy and doing a lot of physical things. So it's just, I just want to make sure I healed properly and took it really slow. So ended up sleeping a lot. By the end of the first week, I felt almost back to normal. And now after 2 weeks, I feel like I could go back to work, but I'm going to take off so that I won't go back to work till 3 weeks, just so that I can give my body a chance to completely heal. But if I had known ahead of time that the surgery would be this easy relatively, I probably wouldn't have had so much anxiety, and I wouldn't have put it off for 1.5 years and suffered through the pain of the fibroid growing inside me. It grew from 11 to 15 centimeters in 1.5 years. I documented that in my other video about trying to treat it naturally. I'm going to maybe make another video about all that, but I kind of think that it's not true about vegan diet and vegetarian diet shrinking fibroids or preventing them. I've chatted with a lot of women on the Facebook group for fibroid removals, and some of them have been vegetarians and vegans for years, and they still have fibroids. I personally ate organic, pretty much grain-free, organic grass-fed meat, eggs, and that for many years before the fibroid. So I did cut out meat, dairy, and eggs for 1.5 years, and the fibroid grew. So I'll get into more of that later. I kind of want to just focus on the surgery and the recovery. So my mom stayed with me for about from Thursday to Saturday, so a little more than a week. So she stayed, and that helped me a lot because I didn't have to like do dishes or make food. I could really just focus on resting and healing. And there is pain during that time, but I quit all pain pills probably by the 3rd day. I would take an ibuprofen maybe once on day 4 and once on day 5, and I did CBD oil. So I tried as soon as I got home from the hospital. My mom was like, they had you on so much medication. They were coming in my room every few hours, and I was just taking like OxyContin or whatever, and ibuprofen and Tylenol. So when I got home, I wanted to detox all of that, and I started taking CBD oil. I did after I had a bowel movement, which didn't happen until I think day 3 or 4, which they said is really normal for surgery once your bowels are touched, and the anesthesia can make that happen. So I was very relieved when I did, and then I was regular ever since then. But once I did have that, I took activated charcoal because that will bind to any poisons or / medications in your body and help eliminate them from your system. So I did do that, and before surgery, I was taking high doses of vitamin C because I read that could help. So I did that, and I'm continuing to do that. I also have been taking raw spirulina, which I get at the farmer's market, and right before surgery I got 2 jars of fresh raw spirulina, and I would just eat it by the spoonful during recovery. And I just went to the farmer's market yesterday and got 2 more jars, so I'll continue that. I'm also, I know it's controversial for fibroids, but a friend of mine owns a farm, and she just had fresh veal liver. And since my iron was borderline low, I know liver is really high in iron. I've also been a fan of liver for many years, and so I've just started eating liver yesterday. and it makes me feel very energized, and I feel like it's helping me heal. So yeah, I think, if you do have the open myo surgery, it's about a week of really focused healing. And then after that, it's just taking it easy, which I'm quite enjoying. I have the entire week off work. It's sunny here, it's beautiful. I've just been working on my music and organizing my house, sunbathing, gardening, stuff that I don't always have enough time for when I have my busy work schedule. So in a way, it's kind of like a little staycation. I'm trying to make the best of the situation. What else can I tell you about the recovery? The scar's healing pretty nice and thin. She did a 3-inch incision right at my hairline. So I'm going to show you that in a minute. And it's healing. It's only 3 inches. So what she did, which I don't know how exactly she did it, but cut the fibroid up in pieces inside and pulled it out through the incision. And I mean, it's still a little tender, but it's not that noticeable. I still get a little tired. I went to the farmer's market in Beach yesterday with my friend. She picked me up. I'm still not driving. And I did feel very tired by the end of the day. So I don't quite have my full energy back, but I'm very happy with how I feel and how what I notice the most is just being able to breathe deeply into my abdomen and fill it up with air. And it's just amazing that there's not this huge block there. So it feels really good. And I've been focusing on meditating and taking deep breaths. And I feel like I'm healing really well. And I'll be going back to work next week. So I'm actually looking forward to that. And yeah, overall, if I had known it was this easy, I probably wouldn't have had so much anxiety around it. I know a lot of women have fear of surgery, not just me. So I would just, my advice to women out there dealing with this is to find a surgeon that you're very comfortable with, because I would not have been able to go through this procedure if I didn't find Dr. Jacoby. I talked to another surgeon before, and she just had a lot of confidence and a lot of skill to back it up. So I don't think that you necessarily need a hysterectomy when you have fibroids. So the myomectomy for me was the right choice. I don't want to disrupt my whole system and hormone system by removing an organ, basically. Doctors don't always know every function of an organ in your body, and I would like to keep my womb. So that's why I opted for the myomectomy. And if you have any questions, feel free to email me. I'm happy to help any way I can and offer any advice or experience I have. So I guess that's it. And I'm just happy to be on this side of being fibroid free. It feels like a new beginning for me. I suffered a lot in the last year and a half, and it kind of consumed my life. So I'm happy to have my energy freed up from dealing with this and focus on healing even more. So I'll show you the scar, the incision. It's healing. It's like pretty much scabbed over now. I am going to go see a Mayan masseuse that will massage the area so that it breaks up scar tissue and helps blood flow in the area. I'm going to call them today. I know I can start that right away. So then, okay, I'll just show you my abdomen. And let's see where the light's better. There we go. So It's still a little swollen right here, but a lot smaller than it was. And there's the incision. So it's really just like a line. There's a little swelling right here. It's puffy and it's a little sore. But I was kind of worried about the scar, and I don't think it's that bad even now, as it's still in the healing process. And I think it'll like flatten out here when the swelling goes down. You can kind of see the bump of the swelling, probably where the tissues are all around here. But a very small scar, and it's really low. So when I wear my swimsuits, you don't even see it. Okay, well, thanks for watching. And again, if you have any questions, feel free to message me.